So first I'm going to start with proper hand hygiene. Then I'm going to use 2 patient identifiers, so name and birthday to make sure I have the correct patient. I'm then going to raise my bed to a proper working height, and this is good for me, so I'm going to leave it where it is. Next, I'm going to fold the blankets down and raise the patient's gown up, exposing the genital area. I can also put a warm bed bath blanket on them to keep them cozy and promote privacy. I'm now going to put on my clean exam gloves. And I'm going to provide any pericare necessary and remove any fecal matter to make sure the patient is clean for the procedure. I'm then going to dispose of my gloves properly. Next, I'm going to make sure my patients are at a good working space for me. I'm going to get my red biohazard bag and get it ready. Make sure it's open big enough. Now I'm going to bring my table closer to me, so I'm not turning my back to my sterile field at any time. I am going to open my cath kit. And we have 1-inch margins, so open away from us first. All right, I'm not going to use these gloves. I'm going to pinch, throw them away. I'm now going to put on my sterile gloves. And again, there's 1-inch margins once you get into the inside. They're open, nice and big. I'm going to do my right hand since I'm right hand dominant. Right, pull them on, adjust. And then I'm going to use my left hand, put on my left glove. Adjust my fingers because these are a little bit big. All right. Okay, there we go. I've got my sterile gloves on now. Now I'm going to put my blue sheet on. Under the patient. Okay, fold in, tuck under, make sure it's not touching. Gonna move my cath kit now. Going to put my white sheet on. On and drop. Now I'm going to get the rest of my kit ready. I'm going to open my syringe. I'm going to get my sticks ready and out. And away and throw away. I'm going to open my lube and squirt it out. And away and around. Next, I'm going to open my catheter and put it in the lube. Get ready for the procedure. Okay. Put it in there. It's in there and away, throw away. Make sure it's in there nice and good. Now I'm gonna break sterility with my non-dominant hand. I'm gonna hold the penis at a 90-degree angle. I'm gonna start by wiping the meatus in a nice circular motion and away and around. A little bit further. Away and around, and away and around, and I forgot to attach this. attached, so that works. But you would do that beforehand first. Put that in our sterile. And we're going to insert our catheter. So you do 7 to 9 inches. Tell them to take a deep breath in. Once you see urine, then you push it all the way to the hub in males. Okay. And then we're gonna blow up our balloon. So I've got 10. I'm gonna push in of saline. And now we're gonna break sterility. And screw that, give it a gentle tug, make sure it's secured. And it is. And now I'm gonna document what I pushed in, the catheter, everything I just did. And now I'm going to take the bag and secure it to an immobile part of the bed. So we're going to secure it down here. I'm going to tape this to the patient's leg with a little bit of slack. I'm going to use a stat lock or a piece of tape, and I've got a piece of tape. So I'm going to tape that down. And now I would remove the white piece and the blue piece under, but in case I'd have to redo this, we're going to leave that alone right now. And now for removing the catheter, I would empty the urine, report clarity, odor, how much urine there was, all that good stuff. I'm gonna remove the tape. Throw that away. Okay. And now I'm gonna pull out I'm gonna insert my syringe back, and I put 10 in, so I wanna make sure I get 10 out. I'm getting air bubbles, so almost got it all. Right, I've got it, and I'm going to release it. And I would throw it away. And now I'm going to have the patient take a deep breath, and I'm going to pull it out in one smooth motion. And I would discard of this. And then I'm going to provide the patient with a call light, assess any breakdown of the skin or any redness, irritation from the tape. And that is it.